Hello and welcome. You are watching the Vishwa Shanti Darshan channel, and we have been bringing you videos on peace, on spirituality, and above all, on science. We are very honored to have in our campus today a very, very eminent urologist and andrologist, a surgeon who has made a name for himself not only in India but all over the world. Please join me as I welcome in our studios Dr. Anil Bradu.
कहो कि अपनी प्रीत का गीत न बदलेगा कभी।
तुम भी कहो इस राह का नीत न बदलेगा कभी। प्यार जो टूटा साथ जो छूटा चांद चमकेगा कभी।
आहा हा, आहा हा।
Thank you so much, Doctor, for joining us here today.
My pleasure.
As a doctor, you do feel very satisfied when you help a patient. They recover. I think the maximum blessings go out to the doctors in every part of the world. So, apart from your own specialization, how else do you think you can contribute to giving back to society? Whether it is in our own country or in our neighboring countries or the underprivileged countries.
There are two things I'll add. I'll again bring back the role of my father, who, when I came back to to my country, I didn't have a job in place. I was very hopeful that multiple hospitals will be waiting to grab me and put me in a prominent position in some hospital. Well, I knew I had to apply and go through an interview and so on and so forth. But no, that didn't happen. No one really wanted you here. There are so many people here, and everybody was busy in their own life. It was my father, who was just a businessman, who said, look, you should be your own boss. If you want to help patients and you have been fortunate to have a house, to have a background, then you should be able to help patients on your terms. You should not be dependent on a hospital structure to be able to grant that help to you. And so he himself, in our own place where we were staying, converted the ground floor of the premises where he was living, and he shifted to another floor so that a small urology setup could be made, where I could practice on my terms and conditions. And he said, if anyone comes to your door and asks for help in urology, never say no. Never say no just because he cannot afford.
Okay.
And till this date, it's almost 24 years that we started the center, and I have not regretted that decision. I think I am able to provide help to anyone who comes to my door, and I do not really think what it is going to bring to me or to my hospital. I only feel that someone has sent him to me, and this place belongs to my father, and I'm only conducting myself as a urologist, so I must help anyone who comes to my. So I think that feeling of gratitude I have purely to my father for having put those ideas in my head, and I was able to practice that. And I also realized that it's not just urology. I'm a qualified doctor. I've done my MBBS, I've done my general surgery, I did my urology, and I might be doing super specialization only in endourology today, or in reconstructive urology or uro-oncology, all these subspecializations we talk about. But for a common man, a doctor is someone who's going to be able to help for his common problems. And he identifies a doctor who can help, even if it is a cough, cold, fever, it's a small accident, injury, and he requires assistance for his heart problem or a diabetes. You must not cut off yourself away from that. So I made it a point to be part of the Indian Medical Association in Chembur, and also the Mumbai Urological Society and the chapter of the Urological Society, so that we could not only communicate with our peers, with our seniors and juniors, we could also go out into the community and conduct camps, conduct diagnostic camps, free operative camps, and be available for whatever the communities need help in. And herein came the role of institutions and organizations like the Rotary, the Rotary International and Rotary clubs. They have a mission, and at least 30 to 40% of the mission is related to health.
Right.
And they need help from the medical fraternity to be able to provide that health. So what can a doctor do? What are the common problems in your society today? We are number one growing in diabetes and hypertension and heart disease today.
True.
So it's not purely urological problems, dealing with urinary tract, but everything in diabetes and hypertension can be related to a kidney. So if you don't address common problems like diabetes and hypertension in community, you're not protecting your kidneys. You're not, controlling your peripheral vessels. So therefore, going out to communities and educating them and helping them in diagnosing and preventing common problems like diabetes, hypertension, or cardiac disease is something which all of us in the medical fraternity can do and should do. And there are simple things which we can do to teach them, to educate them. Moreover, I also realized that the Rotary International gives you an opportunity to be able to take your work and teach to areas which are less privileged. So I have been able to go to the SAARC countries, to Nepal, for example, to Sri Lanka, and also to the East African countries where they needed help from a specialist like in urology to deal with problems like urinary incontinence, urinary tract infections, prostates, circumcisions. We would think circumcision is a very small surgery, but circumcision is the number one procedure which was propagated by the governments in Uganda because they wanted to prevent AIDS, HIV, and they knew that HIV can spread easily through sexual intercourse. And if the boys or the young men were circumcised, then the chances of transmitting HIV diseases is fairly less. And therefore, on a mass scale, to be able to provide the knowledge and the expertise of simple skills in practice to practitioners and nurse practitioners and doctors was something which I could go from India representing the Rotary International and teaching them in Uganda. Similarly, trying to help associate with the Rotary International in their mission to ensure that their funds are better utilized for appropriate purposes. Development of transplant centers in hilly areas in Nepal, which are far away from cities. You can imagine their patient had to travel 6 hours by a journey by bus to go to a center to get dialysis, do dialysis for 6 hours, again go back by bus 6 hours to go back to the city, have a gap of 1 day and again come back the third day to have dialysis. So these are problems in communities, and that these problems can be addressed by taking help from Rotary International and funds. But what they wanted was the doctors should inspect, make sure that the facilities are appropriate, staffing is appropriate, then skills and the knowledge are imparted in the correct way so that the money is used for the right causes. So as doctors, I was like a member of the cadre. They called it as a cadre member. So you could visit these cities and countries. I did it in Rajkot too, where there were funds donated for this purpose. And that makes you feel better that you're communicating as a doctor, not just in what you're specialized, but your skills and your knowledge in the medical fraternity can help in such a big way for you to reach out in communities world over.